Hi friends, this is Dr. Sandeep Banerjee, founder director of Pelvinic, and I am a practicing colorectal and coloproctologist working in my center, that's Pelvinic, and in Apollo Spectra Kailash Colony, and also associated with multiple other hospitals. Today I'm going to speak something about the anal fistula. The problem is there is no information anywhere available whereby people will come to know what they should do, how they will diagnose whether the problems they are having is an anal fistula or something else, and if it is being diagnosed, what is the surgery, what is the type of treatment, and whether who will be a best person to take care of this anal fistula. Anal fistula, जिसे हम हिंदी में भगंदर भी कहते हैं, एक तरह का सुरंग होता है. इट्स अ ट्रैक्ट विच इज communicating the anus with an outside opening. So you see, this is the anal opening. There are two groups of circular muscles which are called as a sphincter muscle. And why sphincter? Because during defecation, these muscles alternately contract and relax in order to help the defecation process from the rectum. Internal sphincter muscle is under our control, which is an involuntary muscle. So these two sphincters, external sphincter, internal sphincter. This is the anus, this is the anal opening. These are anal cushions and anal glands. This is anal cushion, this is anal glands and crypts. A fistula will be a tract which will be having one internal opening, अंदर की एक opening जो towards and inside the anus, an external opening towards the skin. And because this tract is very small in diameter, in few millimeters, so whatever amount of stool or whatever is passing, it gets obstructed in between the tract. Because of the stool, it carries bacteria, so there is a accumulation of pus, swelling, patient will feel pain, and then there will be a sudden accumulation followed by the discharge of the pus. So patient ये complain करेगा कि I have a problem whereby in between the days I am okay, then suddenly I have pain and feeling of some swelling in the anus, and then sudden discharges of the pus in a good amount, and that makes me very comfort and that makes me relieved and I feel I am okay. So this process will go on, and then the infected tracts of the fistula matures and form a matured fistulous tract. And once it is formed, it has to be removed surgically, or surgically some treatment has to be done in order to either get the fistula out or sealed completely. Other than this, no medicine can help your fistula. So now coming to the types of fistula. Are every fistula same? No. So as you see, this is a very simple fistula which is not involving any of the muscle. So this is called a simple fistula. The other one is this intersphincteric fistula. Again, this is involving the muscle, but in between the muscle plane, in between the two sphincter muscle. So it is intersphincteric fistula. Again, it is not as simple as this, but not as complex of the other fistulas which I'll describe. So it is in between intersphincteric fistula. Then you will see this is a transsphincteric fistula, whereby the fistula goes through both internal and external tract, and it forms an internal opening inside the anus. So this is almost a complex fistula. Then other two complex fistulas is, this is a suprasphincteric fistula, whereby the tract remains extrasphincteric, then it pierces the levator ani and it enter inside the anus. So sphincter ke upar se it's going above the sphincter, so that's the reason why it is called suprasphincteric fistula. And the one last is an extrasphincteric fistula, jahan pe this is not even coming through any of the sphincter, it is lying outside the sphincter, piercing the higher muscle which is called levator, and somewhere down in rectum it opens up. So lot many patients do come with this type of complex fistula, where sometimes patient has been advised by some sort of a surgeon who are not very expert in fistula, that since because this is opening directly into the rectum, so you need to make a diversion of your bowel, that's called stoma, in your abdomen, temporary basis for 2 to 3 months, which is not required, because we are doing this type of surgery where even this type of fistula we are helping the patient to heal. So friends, this is the type of all fistulas roughly, out of which I have said simple, in between the simple and complex, all three are complex, especially these two extra and suprasphincterics are super complex. That is about the knowledge of the fistula and the anatomy of the fistula. We'll discuss about the details about what is the treatment, how it should be taken care of, and who are the best people to take care of a fistula.